One of the items Franken's vote would help the president with is health care reform. Today, the administration's point person on the effort was long on enthusiasm, but short on specifics. Chief political correspondent Carl Cameron has the story from Capitol Hill.
It was Kathleen Sebelius' first appearance before Congress as the Obama administration's newly minted Health and Human Services Secretary.
Health care reform cannot wait and will not wait another year.
Committee Chairman Charlie Rangel, who supports reform, began with a warning.
There are really sharp differences of opinion on this committee as to how we achieve near universal health care.
But Republicans, greatly outnumbered, so far have little to sharply disagree on.
Is there any timetable for the administration to release a specific legislative proposal on health care to the Congress? And if there is, could you shed some light on that?
Sebelius said no, the legislature will craft it with White House help. The president wants $634 billion for openers. It could cost more than $1 trillion the first decade. Again, no specifics from Sebelius.
That you can't fully cost out a plan until you know what you're paying for.
The administration says if you like your current health care, you may keep it. Private employers may be required to help cover the uninsured. Public health care under Medicare and other programs will be expanded. The goal is more choice, competition, and less cost.
Reform must guarantee choice of doctors and health plans, including a choice between a public and private plan option, that no American should be forced to give up a doctor they trust or a health plan they like.
But at least two key Democratic senators, Ben Nelson of Nebraska and Arlen Specter of Pennsylvania, who often craft centrist deals on controversial issues, oppose a government-run insurance program. Republicans warn if Uncle Sam regulates and provides health insurance, the private sector will face a crushing disadvantage.
The way I see it, it's kind of like my daughter's lemonade stand competing against McDonald's. It's having the referee, the government, also be a player in the same game, and actuarially speaking, it's almost impossible to make that a fair game.
Republicans further complain that the legislative process itself is no longer a fair game because Democrats have said that they are willing to use the legislative shortcut of reconciliation, which means they could ram health care through over Republican objections without getting the normal 60 votes needed to end debate. The GOP says that's an abuse of power that will not only hurt health care, but just about everything else on Capitol Hill this year.